Well, a warm welcome to today's talk. It's Monday the 23rd of August. I'm going to focus mostly on the United States, I think, in this video, where the level of hospitalizations is increasing really quite alarmingly in some states, and cases are still going up. So let's think about some context to this first of all. These contextualization slides are often quite useful. Now, New Zealand and Australia. Now, people have been openly saying that the zero policy for COVID-19 in New Zealand is basically probably finished now. It's going to be hard to see how it's going to be eradicated now. In Australia, it's inconceivable now that they could go back to a zero COVID situation, which is such a pity after doing so well for so long. But they were somewhat slow on the vaccination uptake. So I'm afraid in Australia, I think now for sure the genie is out of the bottle. It won't go back in, and New Zealand potentially the same situation as well. Real pity. So it really is a race to vaccinate in the antipodes now. That is for sure. Going up, Netherlands, this lovely drop there in the Netherlands in cases, but levelling off now, I think it would have to be said, as indeed quite a few cases in Europe. South Africa, well, still winter in South Africa. We'll be heading into spring fairly soon, but cases still reasonably high. Ireland, despite the high vaccination rate, the cases in Ireland are still going up. Now, what is happening here is the vaccination programme in Ireland got off slower, shall we say, than in the United Kingdom, for example. Slower than in the United States. So there's a longer lag because we know it's taking quite a long time for the immunity to kick in. We know the immunity does kick in, but it takes a bit of longer time. And I think that's why we're seeing this increase in cases in Ireland still. United Kingdom, well, definitely an uptick there, an increase there. It had looked promising for so long. But the United States, I'm afraid it's up all the time, an upward trajectory in the United States. But it's unequal, as we'll see in this talk. Southern states particularly more concerning than some northern states. So that is the cases. This is the vaccination status, proportion of the population doubly vaccinated. Now, you don't need me to tell you about the severe implications of this in South Africa. This is not a good situation for South Africa. We can see the pandemic rumbling on for a long time in South Africa as a result of just that line on that graph. New Zealand, Australia picking up at comparable rates with vaccines, but an awful long way to go. And in both countries, we're talking about Delta variant. This is so transmissible. It really is a bit of a worry. And hospital capacity, I'm not so sure about New Zealand. I'm going to do some research on that. But in Australia, we know it's actually more limited than you would think for a sophisticated first world country like Australia. I'm afraid problems ahead in terms of hospitalisation and stress on the healthcare system in Australia, I'm afraid. I think that will pan out over the next month or two. United Kingdom, vaccines okay. Netherlands actually overtaken the United Kingdom now. A number of people doubly vaccinated. Good job there in Netherlands. Ireland, very good. Canada, very good, of course. Just the delay effect that we talked about in Ireland. Whereas in the Netherlands, I think we are already seeing the benefit. Now, I want to focus your attention on this next slide because this is really the really important one here. Hospitalizations. Canada, Netherlands, manageable. Ireland still going up. Limited capacity in Ireland. Very limited capacity, as we've noticed from our talks with Irish radio. United Kingdom hospitalizations still much higher than we would like. But the United States, dear oh dear, hospitalizations going up really quite dramatically in the United States. And that somewhat unequally. It's worse in some areas than others. So I'll just show you this this graphic here from the United States. This is live time from the CDC. And here we see the figures. Current 7-day average, 79,310. Up from 69,269 the prior 7 days. Up 14.5%. Still down on the peak, of course, but up 14.5%. We see the peak there. But we see this still going up. And this is really quite a big it's quite a big, well, it is a big concern in the United States. So let's just look at some other United States data before we go on to that. Now, as a result of the increase in cases in the United States, vaccines are increasing. And this is very reassuring. So trends in the number of COVID-19 vaccines in the United States. And again, this is live data. So we do see it going up somewhat in the country. But the good news here is that states that particularly were behind, let's take, for example, Alabama. And we see that's really going up quite nicely. The number of daily vaccinations in Alabama going up really quite considerably as people in Alabama and other southern states are realising the importance of vaccination. We could show other examples, maybe look at one more. Let's look at, let's try Arkansas. Yep, and we see the same kind of pattern there in Arkansas, an increase in people getting the vaccine. As, well, I guess what's happening is people are seeing literally people around about them getting sick. So the United States, California, Texas, Florida now over 3 million cases. So pretty big escalation in these highly populated states, Texas, Florida, California with their high populations. Good news, I wrote that recently. Actually, that comes from the American news that I watched early morning. So basically today, Monday, it's probable or possible Monday or Tuesday, or hopefully, probably Monday or Tuesday or Wednesday. You never know quite with these things, but the FDA is likely to give full approval to the vaccine, to the Pfizer vaccine, literally any hour now. So that is encouraging, full approval for the Pfizer vaccine, the first vaccine to move off emergency use approval, which should give people quite a lot of reassurance, I would hope, but also makes it easier, now it's an approved medication, that more sectors in the United States are going to mandate vaccination. Inevitably. That is going to be happening, and indeed is happening now. Mr. and Mrs. Jesse Jackson hospitalised despite being vaccinated in January, prior presidential candidate, can't quite remember when, Reverend Jesse Jackson, being publicised quite a lot that this couple, despite being vaccinated, fully vaccinated in finishing January, been hospitalised. They are in a higher risk category, of course. They are older individuals, and I must say Mr. Jackson probably has a slightly higher BMI than he would prefer, which of course is going to be a risk factor. But I want us to keep this in context, because it's easy to look at famous individuals and draw too much inference from that. Because we looked at data from New York, from memory 10.5 million people in New York data based on. It's actually on this site here. We used it quite extensively a few days ago. So this was updated, 18th of August, new COVID-19 cases and hospitalizations by vaccination status in New York. I'll put the link there. Of course, you can read the whole document if you would care to do so. It's there. But what that was showing is data on the 25th of July, protection against infection after 2 vaccines, just a tad under 80%. So just a tad under 80%. And the point about this figure is it had gone down from a couple of months before. Vaccine efficiency against protecting against infection is waning. But even after adjusting for age-adjusted effects against hospitalisation, July 25th, same date, the protection against hospitalisation was basically 92 to 95%. So high levels of protection against hospitalisation, and that had been maintained over the past few months. So bear in mind when we look at people like Mr. and Mrs. Jackson, who of course we wish as well as hope they do really well. But this is the minority. The vast majority of people being hospitalised are not vaccinated because of the 92 to 95% protection. Now, the CDC were saying 97% of people being admitted to hospital were unvaccinated. We know the number is less than that. We don't know the precise number, but it's probably in that range, 92 to 95%. So that leaves 5 to 8%. of people are vaccinated who are going into hospital. So the vast minority of hospitalizations have been vaccinated. The vast majority of hospitalizations are unvaccinated. That's the simple statistics. Now, talking about this hospital pressure, which is a worry in the States, and it's a worry for two reasons. Firstly, COVID patients are going to find it difficult to get treated, but we're going to look at some examples of other patients who aren't getting treated, which is terrible. And of course, in the UK, the NHS waiting lists are at an all-time high, millions of people waiting for treatment. It really is a terrible situation, people not being able to get treatment. I mean, I was just talking to a friend yesterday, and you'll have friends, if you're in the UK, you'll understand this. I've talked to a friend yesterday, and arthritic hip for many years, been on the waiting list for an operation for quite a few months now, but of course, no appointment for his hip replacement in sight. Meanwhile, his mobility is reduced. He's in pretty well constant pain, and that the treatment is not available yet, which really is a pity. Both in terms of personal suffering and reducing his productivity. But anyway, getting back to the states, hospital pressure: Alabama, Florida, Georgia, Mississippi, Texas, Arkansas, Louisiana. High pressure on hospitals. I've read a report about some stroke victim or victims in Louisiana not getting treatment. Now, this is just terrible. You see, if someone has a stroke, what normally happens is there's a blood clot in one of the blood vessels supplying the brain. So if we get these patients early, we can give drugs or even do an intravascular intervention to take that blood clot out or dissolve that blood clot. And sometimes the stroke can essentially go away. If they're not treated, they can be left with permanent disability. So it really is a pity that this is not being done. It's got a significant impact on future morbidity in the country. This is going to affect this individual for another 10, 20 years of their life, or however long they're going to survive for after their stroke. Realising this, Mississippi authorities, for example, just using Mississippi, $500 fine or indeed imprisonment for not self-isolating once someone knows they're infected. So the importance of this is now being realised, or albeit somewhat belatedly. Now, it doesn't. We said we don't want to give too many personal examples, but let's just give one. Joel Valdez is in Houston, where the hospital is at, the ITU capacity is at or above capacity. And he says this: having broken bones and bullets in me for over a week now, it's a little frustrating. Now, I don't know if he's got English blood, but that's classic understatement, isn't it? I mean, I have seen patients left overnight because they can't get surgery with broken bones, and every time they move, the bone ends can move, and it's an agonising situation. Whereas Mr. Valdez apparently was shot, innocent victim of shooting. Presumably the bullets have broken some of his bones, and he's been waiting for 10 days for surgery. Probably not so much the surgeon's availability, but with complex surgery such as multiple injuries, you often need critical care or intensive care facilities for a few hours or a day or so after, while the patient restabilises. Sometimes only just for a few hours, but without that, the surgery is just too risky. So really terrible to be left in so much pain for that amount of time. It really is quite upsetting to read about this. But when you've seen people in this kind of pain and you know what it's like. Hospital authorities are saying, due to strained resources, surgical patients are being prioritised based on several factors, which unfortunately may result in a delay of non-emergency surgical procedures. So we've got quite a lot of delaying. And again, I've been in situations where there's been a delay for surgery. You'll admit someone, they're ready for the surgery. I mean, surgery is frightening. You really don't see a patient who's not anxious about getting surgery, even though the anaesthetics and everything, of course, are typically excellent, but people get anxious about it, and then patients can be fasted, ready to go to theatre, and then sometimes you have to come out and say, well, I'm sorry, we can't do you today. So they've had all that build-up and all that fasting, and then they've got to go through it again the next day or the next week. It's just terrible. It really is tantamount to psychological torture. It's sometimes unavoidable, horrible thing to do to someone. When you look at someone's face when you tell them they're not going to get that surgery that day, it's just terrible. Oregon, for example, activated 1,500 members of the National Guard to support 20 hospitals, seemingly pretty well everywhere in the United States. Severe shortages of skilled staff. Now, I've just got a quote here from Mr. Donald Trump. And he says this, I recommend take the vaccines. I did it. It's good. Take the vaccines. So a direct quote from former last President Donald Trump. So Mr. Trump there clearly saying that. Now, he said this in a large political rally where a lot of people there didn't support what he said, but he had the he had the guts really to stand up and say it. I recommend take the vaccines. I did it. It's good. Take the vaccine. So we have a political leader recommending taking the vaccines. Let's hope people who agree with that political ideology take the vaccines. In the UK, we find it bizarre that questions about mask wearing and vaccination are party political. We just find that bizarre. So whatever party you're in, there we've got Mr. Trump, take the vaccines. That's what the man is saying. And again, just an experience from one of the doctors here, really. This doctor's a radiation oncologist, so he does X-ray therapy for people with, and other radiation therapies for people with cancer, Florida, Tampa. I'm just going to read you out a few of the things he said here, because it really does quite hard hitting, really. This is a report from the article in the Washington Post. The unvaccinated are killing people in ways they probably never imagined. So it's not just themselves; it's the knock-on effect in the health service, as we've just seen with Mr. Joel Valdez, who's hopefully being operated now, but lay around for days with bullets in him. I mean, the risk of infection, apart from anything else. Anyway, this oncologist, my hospital, one of the largest in central Florida, was full of COVID patients, more than 90% of whom were unvaccinated. So again, confirmation. This doctor is saying 90% of patients unvaccinated. We had no beds available. We had paused elective surgeries the previous week. Our emergency department had a 12-hour wait that day. Simply unsafe. But I had no choice. For the first time in my career, I had to say no to a patient who was an urgent referral for oncological cancer treatment. And then the doctor says, please do your part and get vaccinated. I, for one, don't want to have to turn away more people who need care. Now, this particular patient was treated at another facility, but we've got a radiation oncologist here who, according to this report, has basically never turned a patient away in his life and has had to do so. Heartbreaking for the doctor and for the patient. Right, I'm going to just finish off with a few FAQs now. I think it's probably good to do. So Bob asks, so following your logic, John, if someone is vaccinated, it is fine for them not to wear a mask. If they get infected, that will boost their immunity. Right, it may boost their immunity. We're still looking at data on that, Bob. But they should wear a mask. Emphatically, they should wear a mask to protect those around them. The main reason for wearing a mask is not to protect me, although it does. The main reason to wear a mask is to protect those around me from me. So while it is true, we believe that it's true that if someone has had 2 doses of vaccine, then gets the infection, that's going to boost their immunity. Doubly vaccinated people, as per CDC guidelines, and as now what is polite, not mandated in the UK, but what is the polite thing to do is to wear a mask to protect those around us. Children, of course, under 16 in the UK are unvaccinated. So it's to protect those. Some people don't respond to the vaccine. They're immunocompromised. Some people are particularly at risk from getting more severe infections for things like high blood pressure, increasing age, cardiovascular disease, respiratory disease, and the obesity, hypertension, the morbidities we know about. So the answer to that one, Bob, is no, we should still wear a mask. Jola, those who like me, ask this, those who like me are severely immunocompromised and having been tested have found that the double dose vaccine has generated negligible antibodies. Sorry to hear that, Jola. We still need some further protection to keep from severe sickness, death, as exposing ourselves to the disease is a high risk strategy. So Jola really illustrates the answer to Bob's question, why it's so important. So the reason it's so important, Bob, is to protect Jola. Excellent point, Jola. John writes in, thanks for a very interesting, stimulating talk, John. I have one question arising. Why do we then need annual boosters to flu shots if this is related to how the two viruses mutate? Okay, so The thing about influenza is there's many different viruses that can threaten us. So like last year, my flu shot was quadrivalent. So out of the dozen or so influenza viruses that could cause next winter's pandemic, clever people pick the 4 that are most likely and give us antigens to those 4. So there's more flu viruses around. There's a bigger variety of influenza viruses than there is of coronaviruses. So if one virus falls, there's another one waiting behind it, as it were, to take its place. And as well as that, the influenza virus is even less stable than the coronavirus. So we know the coronavirus mutates, but the influenza virus mutates more readily, more often. There's this genetic drifting, and from time to time there's what we call a genetic shift, where there's a big change in the genetic material of the virus. So it's due to the number of the viruses, John, and the and their quickness to mutate would be the answer to that question. Final question from Ruth. Interesting theory about natural infection plus 2 vaccines, which we were talking about on Saturday now. There's no such thing as a silly question. There's never, always ask questions. But why does this not apply to flu or the common cold? Again, we've answered that in terms of influenza, but the common cold, there are 4 coronaviruses can cause the common cold, or common cold type symptoms, but there's, tens or hundreds probably of different rhinoviruses, nose viruses, that can cause cold. So you could get a cold. You can have terrible cold symptoms. I'm sure we've all been here at one time. You can have terrible cold symptoms, be really quite knocked off, and terrible runny nose and horrible cold symptoms for 5 days maybe sometimes. And then get over that. And then just a few weeks later, you can have another one, sometimes just as bad, because it's a completely different, well, it's not completely different. It's another rhinovirus, but it's a rhinovirus to which you don't have immunity. So again, it's the number of viruses which are able to cause common cold type symptoms, infecting the upper respiratory mucous membranes. And again, these RNA viruses can mutate very quickly. So good questions from Bob, Jola, John and Ruth. Thank you for those. And thank you for watching this update. Oh, I'm going to do one shortly. I've almost prepped it on the new antibody tests that are coming out in the UK. So we'll see how we get on, but that's the next thing. Thanks for watching.